extra things. So you can learn a little bit more about mold and mast cell and histamines and a few other topical things. Can we have the next slide? Okay, this is quite important for people that are treating patients with chronic fatigue and fibromyalgia. This is actually a formal document written in Canada by a guy called Bruce Carruthers and Marjorie Van de Sande. And it's got specific criteria for chronic fatigue and fibromyalgia. The fatigue has got to be very, very unremitting. So severe fatigue, not just the tiredness at the end of the day, but severe unexplained fatigue. So you check the iron, check the thyroid, all the normal kind of things we would do, but their fatigue is quite severe. And what makes you think of chronic fatigue is really the fact that it's post-exertional. So after they do anything, they feel really, really wiped out. Now this post-exertional fatigue could be physical or mental, but it goes on and on. So it can go for a day, it can go for 2 days. So some of them will say, I felt good this morning, and so I went out shopping. And after half an hour of shopping, I felt so tired, I had to come back home and lie down. So it's that very severe post-exertional fatigue. They get insomnia. And of course, there are 2 types of insomnia. This insomnia you get where you can't fall asleep, and that's called sleep initiation insomnia. And the second one is maintenance insomnia, where you can fall asleep and wake up in the middle of the night. They get a lot of joint pains. Now, these days, if I get someone with particularly migratory joint pain, I'm thinking about Lyme disease. Now, I'm not sure what the situation is like in Kuala Lumpur, but we are getting more and more Lyme disease. So if someone comes to you and says, I've got pain in the joint, in my knee, and then suddenly it's moved to my elbow, and then it's moved to my neck, this is over a few days, that's making you suggest that it's some kind of tick-borne illness. So can keep that in the background. But certainly the people with chronic fatigue, the joint pain will be quite severe. And there will not be any obvious signs of arthritis. So they're not going to have swelling or crepitus, just that deep ache without an obvious explanation. Now the neurocognitive symptoms, so the brain symptoms are very important. And the main one, of course, is brain fog. They can get lots of memory issues, speech issues, finding words, remembering names. Some of them will even go into a room and they describe this thing of sensory overload. So if there are too many people or too many lights or too many sounds, they just can't cope in that situation. But they all describe their brain as being in a cloud, like a real brain fog. Next slide, please. Now, in the next group, they have a lot of autonomic symptoms, and we're going to talk about that in the case history. Postural hypertension, obviously they get, when they stand up, their blood pressure drops quite significantly, and the problem is when their blood pressure drops, they're not oxygenating their brain, and so they can't think. So if you can increase their standing blood pressure, you're going to make a big difference to how their brain functions. They get certainly IBS symptoms. Some of them can be very, very pale. They get nausea, their bowels can vary, and they get lots of frequency. They also get neuroendocrine symptoms, particularly with a low body temperature. So if someone has a consistent body temperature below 36, that sort of goes with a chronic fatigue picture. Now the temperature varies a lot. So if one day it's 35.6 and the next day it's 36.7, and then it keeps jumping around, that's more of an adrenal fatigue picture. And these days we're calling it either HPA dysfunction, because people don't like the term adrenal fatigue, but it does exist. But it's now being called either HPA dysfunction or just burnout. Now they can get a lot of immune manifestations with lymph nodes and sore throats, and particularly sensitive to various chemicals and medicines. Of course, the duration has to be more than 6 months for adults, Children is a little bit uncommon. I don't actually see a lot of kids with chronic fatigue. Now, what distinguishes chronic fatigue with fibromyalgia is that the people with fibromyalgia get a lot of pain and they get a lot of tender trigger points. And for them, sleep disturbances are much, much worse. Now, the other people that get really bad sleep disturbances are going to be people with Lyme disease, and there's a co-infection called Bartonella, Bartonella, Bartonella. And Bartonella used to be called cat scratch disease, where you can get it from animals that scratch you. But we now know these days it's spread quite often by tick bites. And that can cause quite profound neurological, but also sleep disturbances. And particularly when you're treating them, often they actually get a little bit worse. And that confirms the diagnosis. So if the patient doesn't change with whatever you're doing with antibiotics usually, but even if you do some herbal remedies, your diagnosis is probably not right. So either they get slightly better or they get significantly worse. Okay, now the next one's an even better classification by a guy called Richard Schloeffel, who's like the Sydney expert on chronic fatigue. He has specialized in this and he's done thousands of people with chronic fatigue. And he breaks them into individual groups. Sadi, can I have the next slide, please? Thanks. Now this is a better classification. So you can subgroup them into these things. Quite often they'll have one or two different classifications, will be for the same patient. So the first one is neuropsychiatric, where they get mainly anxiety, depression, obsessive compulsive disorder, that's OCD, and some of them can get frank psychosis. Now, whenever someone has this autonomic nervous system not working very well, that's what we call postural hypertension. POTS is a very severe form of postural hypertension. So when they stand up, not only does their blood pressure drop, but their pulse rate goes up by more than 25% of what it was when they were lying down. Okay, so that's severe postural hypertension. It's called POTS. And the people with POTS, often they have a connective tissue disease. So if you want to know if they've got a connective tissue disease, you ask them when they were very young if they were extremely flexible. You know how some people can get their thumb and with their thumb touch the forearm? So those people are very hyperflexible. Or when they're standing up, not only can they reach the ground, but they get their palms of their hands completely flat on the ground with their knees completely straight. And there's something called the Baton score that can give you a number on their extreme flexibility. Now, people that have chronic fatigue and have insomnia, one of the important things you must exclude is something called obstructive sleep apnea and central sleep apnea. Now, what I want to mention here is something that I've discovered. There's actually a device you can buy on the internet called Power Breathe Classic. Okay, it's on the slide, but I couldn't fit the word classic in, but it's called Power Breathe Classic. It's a little plastic device. It's not very big. It's about the size of a Ventolin inhaler. And when the patients blow into that 20 times in the morning and 20 times at night, it actually stops the trachea from collapsing. And it can actually reverse even moderate sleep apnea. So as long as the sleep apnea is not due to something in their nose, this Power Breathe Classic can reverse it. So these days, when I have a patient who I think might have sleep apnea, I actually don't send them for a sleep study. As long as I can't see any polyps in their nose and their nose is clear, they can breathe through it quite well. I actually get them to use the Power Breathe Classic for 6 weeks and then do the test. And quite often, their wife would have been saying, look, this guy's snoring a lot. But once they've used the device, after 6 or 8 weeks, the snoring is much, much better. And they more often than not, they pass the sleep test. Now, we know all about food intolerances and leaky gut and SIBO. But occasionally we see people with very severe chronic constipation that can actually progress to full-blown gastroparesis. So gastroparesis is where the bowel is not working at all. And it's once they get to that stage, it's really hard to fix it. So you really do have to work hard to try and stop someone getting to full-blown gastroparesis. So at the moment, I've got a very difficult patient that I've been seeing in my clinic for about 5 years, who just comes in for a vitamin C infusion every fortnight, and she can't eat anything. So she has a tube going into her stomach, and she's fed by a bag overnight. And we've even put a pacemaker in her abdomen to try and force her bowel to work, but that has not helped. It just reduces her nausea a bit, but she still can't swallow anything. Her bowels just won't work. Unfortunately, she will not let me do any tests, so it's very, very frustrating. Her mother's offered to pay for her testing. Her husband's offered to pay for her testing, but this woman is adamant she's not going to have any testing. So I don't think we're going to get very far with her gastroparesis. Now, in the endocrine things, the commonest things you're going to see are adrenal dysfunction, as we call it, burnout these days. You're going to see some insulin resistance, that's the IR. And quite often when people have got insulin resistance, they've got leptin resistance. So leptin's the hormone that normally stops you eating. But these people, their leptin just doesn't work. And just like you make too much insulin, they make a lot of leptin. And the only way to overcome leptin resistance is either to do very severe fasting. We used to be able to do the HCG injections, but unfortunately we can't get them anymore. So some of the patients will try HCG homeopathic drops for leptin resistance, and sometimes that will work. Okay, so HCG homeopathic drops, look at that. And if you combine that with some amount of fasting, either 2 days a week or missing, breakfast or dinner 2 days a week, that can sometimes help. And then, of course, there are all the genetic conditions that can be associated with chronic fatigue, particularly pyrrole, mitochondrial disease, and as I talked to you about the connective tissue diseases like EDS, stands for Ehlers-Danlos syndrome. So the people with EDS are very hyperflexible. They have connective tissue disease, so they get hypotension. And quite often, even the connective tissue in their eyes doesn't work, and their pupils and their lenses in the eyes are actually quite loose. And they get a lot of heart valve issues. That's the people with Ehlers-Danlos syndrome. But you're going to find this classification system a lot more user-friendly, and you can put people into these little boxes that are a little bit easier to treat. Next slide, please, Ati. Now, in terms of infections, when we actually see people, certainly in Australia, the commonest germ is mycoplasma. So we look at cytomegalovirus and Epstein-Barr virus, but the commonest one for causing chronic fatigue is mycoplasma. So if someone can't afford to test, it would be reasonable, once you've done all the dietary things and the detoxing things, to actually put them on a course of tetracycline, but always with something for biofilms, because these people always have biofilms. And in my case, I'm going to talk to you a little bit about biofilms. Now I'm going to skip tick-borne disease because that's a whole lecture on its own. It's very, very complicated. So if someone doesn't get better, I start investigating them for tick-borne disease. And there's actually a free questionnaire on the internet. Sumi, am I talking? If I'm talking too fast, can you wave? Okay. Am I okay? Good. Okay. Okay, so with tick-borne disease, there's something called the Richard Horowitz, Horowitz. So Richard and Horowitz, Horowitz. And he's got a free questionnaire on the internet that will tell you if someone has got tick-borne disease or not. So it can be very useful. These days, I'm really into detoxing. So I'm going to give you, in my case, a couple of examples of heavy metals. Actually, they're not from my actual patient, but I've thrown them in to make this a bit more interesting. And these days, you can actually assume that everyone that you see whether they are well or not, is toxic. All of us are toxic. Whether we live in KL or whether we live in Sydney, to be honest, if you live in the country in Australia, they use so many chemicals here, so even the country people are quite toxic. So detoxification is going to be a big part of your program. And again, I'll talk about that in my case history. Now, the next one is chronic, that's called CIRS, C-I-R-S, chronic inflammatory response syndrome. And here we're looking at things like mold sensitivity. So only 25% of people that come in contact with mold are sensitive to mycotoxins. So these are the toxins that come off mold, mycotoxins. MCAS stands for mast cell activation syndrome. Mast cell activation syndrome. And you think of mast cells generally with allergic things. You're going to think of mast cells with asthma, allergic sinusitis, anyone with rashes, unexplained rashes, itchy skin. And then finally, there's the story of EMF. Now, one of the ladies that gave you a lecture a few years ago was a girl called Nicole, Nicole, and her surname is B-I-J-L-S-M-A. B-I-J-L-S-M-A. Now, if you go to her website, she's got a fantastic section called Hazards in the Home. So oddly enough, being inside the house is a lot more toxic than being outside because of things like carpet and paint and the things that outgas from all the things that we use. And her little blurb on her website can be very useful. Now, whenever you're treating someone with chronic fatigue, unexplained symptoms, think of chronic dental infections. Now, this is also very important for people with cancer. So send them to a holistic dentist and get their teeth checked, looking for deep-seated infection that an ordinary dentist might not see, or perhaps a root canal. So I think you've got to look at the dental aspect. So people are finding now that patients that have these deep-seated infections in their teeth end up having heart attacks. Not all of them, but a percentage of them. So somehow that infection gets into the heart, whether it's traveling there, I'm not sure, but it certainly seems to be associated with heart attacks. I've seen one person with Arnold-Chiari, where the brain is protruding from, particularly around the cerebellum, is protruding into the kind of spinal passage and causing a lot of obstructive symptoms. And this girl, once she had an operation, all her symptoms disappeared. It was quite amazing. So chronic fatigue completely went away. Now, other chronic infections could be a low-grade chronic infection of the gallbladder. Now, they might not have typical symptoms. They might have very mild symptoms. Can anyone tell me what might make you think that someone's got a gallbladder that's not working very well? Navdeep, you got any ideas? I can't hear you. I think you're muted.
If it's not digesting fats or fatty foods.
So nausea with fats, not digesting fats, chronic constipation, sometimes even diarrhea. What about on their blood tests? Very low triglycerides. Okay, so the triglycerides are very low, like say below 0.5. That's telling you maybe they're not digesting fats very well. And these people, even when you give them olive oil or whatever your favorite oil is, it just goes through them. They get diarrhea straight away. And when you examine them, quite often their skin could be a little bit on the dry side, a little bit itchy. Listen, I'm going to disappear just for 2 seconds. I'm just putting a light on because it's got very dark in my room. 1 second. Sun's gone down very quickly. We've already mentioned fibromyalgia, where they get all the trigger points, severe fatigue, and of course, sleep issues are pretty major. Okay, next slide, please. Now, I've rearranged Professor Mel's mantra just a little bit. So we always start with digestion. So if someone's got digestive issues, the first thing you're going to do is heal the gut. Okay, heal the gut. I've mentioned this to you before, and I do this with all my new patients. I give them 6 betaine hydrochloride tablets. So I have a bottle of betaine hydrochloride on my desk. And I tell them after lunch, have 1. If you get any reflux, that's a good sign. It means you don't need any more and don't take any more tablets. But if they don't get any heartburn or reflux, then the second day they have 2 straight after lunch. Again, if there's no reflux, on the third day they go up to 3. But again, after 2 capsules, if they get any reflux, they don't take any more. Now, if they get up to 3 and we're not provoking reflux, that's a sign that they are really making no stomach acid. Now, the 2 things that help you make stomach acid specifically are B3, vitamin B3, and zinc. So these people are going to be deficient in B3 and zinc. Now, diet, you should by now know all about diet. And again, I'll cover that a bit in my history. But detoxification is very important. As I said to you, everyone needs detoxification. Now, the simple things that you want to do for detoxification is first making sure your patient is drinking enough water, that they're opening their bowels every day. Then the next thing would be to try and induce sweating with either a steam sauna or an infrared sauna, anything that makes them hot. Then the next thing, of course, are things like coffee enemas. A lot of patients don't like coffee enemas, which is understandable. So these days I can write a script for a coffee suppository. So if you talk to one of your compounding pharmacists, sometimes the coffee suppository can be a little more convenient. And then there are oral things like N-acetylcysteine and glutathione. Particularly with the very sick patients, I tend to go easy on the detox. I don't start glutathione too early, particularly with the Lyme patients. We are finding that if you start them on glutathione too early, their brain fog actually gets worse. So we tend to go fairly slowly when we're detoxifying Lyme patients. Now, one of the things that we probably didn't tell you in our series of lectures, which I've discovered subsequently through a Dr. Walter Clin, is that toxic people develop food allergies. So if you've got someone with a lot of food allergies, the first thing you would, of course, think of is severe dysbiosis. So if someone's got many food allergies, so if you do a test, for example, and out of 64 things, if they're allergic to more than 10 or 15, that's suggesting they've got dysbiosis. But certainly toxic people tend to have more food allergies and food intolerances. So always consider that. Okay, next one, please, Sati. So this is my case. CS is a 15-year-old female student. Interestingly, most of the people I see with chronic fatigue, 95% of them are females. And we really don't quite understand why this is so. Is this a genetic thing? Is it a genetic SNP, the single nucleotide polymorphism? So it's some genetic problem? Is this something related to hormones, lack of testosterone? Could it be related to periods and low iron? Again, it's hard to say. Thyroid disease itself is, of course, often more common in women, but I certainly see a lot more women than men. So this girl had very severe fatigue. She got a virus, and then after the virus, it just flattened her completely. So I saw her about a year and a half after she first got sick. She was sleeping a lot. She was tired all the time. When I saw her, she couldn't go to school. Any kind of exercise made her much worse. And she was getting a lot of infections. So she was getting like sore throats almost every couple of months, sometimes even more often. And so far, nothing had helped her. And someone had suggested that she should do an exercise program. Now remember that exercise is now documented evidence to show, if you go to PubMed, there's evidence to show that if you do exercise these people too early, you make them worse. So I tell them, there's a choice between watching a movie or reading a book and going for a walk. Try and relax. It's more important, at least for the first month or two. Once my program is going, then I allow them to exercise. But if they come to me and they say, look, I can walk around the block and I'm not tired, then I encourage them to walk around the block. That's fine. It's not an issue. Now, the other thing with this girl, she had a lot of trouble with sleep. Now, I've talked about this before, but I'll mention it briefly. So we often have to look at what's growing in their bowel, because sometimes it's an imbalance of bacteria that can cause the sleep problems. But if you want to rescue them, if you want to treat them just initially, just to get them better, just to get over that hump. So for sleep onset, I use a lot of quick release melatonin. So if someone's a 15-year-old girl, I'd probably start with 0.5 milligram. I would try and get a tablet that's, say, roughly 1 milligram and cut that into quarters, and let her start with a quarter. And then every 5 days, increase the dose. So the things that help sleep onset are obviously sleep hygiene. You're going to bed at the same time, making sure your room's dark, making sure there's no EMF in the room at night, making sure they haven't got an electric clock next to them, making sure the room is completely dark. And if they can't make it completely dark, at least wear those, like a mask to prevent the light getting in. Melatonin puts them to sleep. And the second one is adenosine, 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 ADENOSINE. It's 100 milligrams, and you put it under the tongue. Adults can use anywhere between 1 and 3. But for a kid this age, I'd start on melatonin. If that, and I couldn't get going with her, then I would start off on 1/2 an adenosine, and say 50 milligrams, and eventually I'd get up to a full one. And it's very safe. It just puts them to sleep. Now, for keeping them asleep, the two things you want to look at, if they say they wake up at 1 or 2 in the morning and they're immediately awake, anyone have any ideas what that could be? Due to if they're incredibly awake at 2 o'clock in the morning. So one moment they're asleep, the next moment they're totally awake, ready to go. We think of hypoglycemia. Okay, because if their blood sugar drops, their sympathetic nervous system takes off and they're incredibly alert. But they tell you that 1 or 2 o'clock in the morning, they're a little bit groggy. That's when you would try some 5-HTP. If they're waking up in the middle of the night and they're still a little bit groggy, consider trying some 5-HTP. Another option is to give them a tiny dose of melatonin, again, 1/4 of a dose, along with another adenosine. And that will work for some people if they get up at 2 o'clock in the morning. So you've got a few options. Okay? I can only see 4 of you, so I'm not sure if you are all following me, but I hope everything's okay. I'm not going too fast. Now, this girl was premature. Now, when I'm actually doing my history, I actually type it up as I go along. And I put little notes on the side. So her mom said she was born premature and she had severe reflux when she was in hospital. So that immediately tells me, even at that stage, this kid probably had some kind of food intolerance. Now, remember the toxins that babies are exposed to are not the toxins that are exposed to necessarily when they're born, but quite often when they're in utero, they're being exposed to a lot of toxins. So that's could explain why some kids are actually born with these food allergies, because when the mom was pregnant, in fact, this girl's mom ended up getting breast cancer. So while the mom was actually pregnant, she might have been exposed to a lot of toxins. She got bronchiolitis, which is usually due to respiratory syncytial virus, you know, the RSV. It can develop into asthma in a percentage, but most of the time they got low immunity. So she developed exercise-induced asthma. And these days, again, I'm thinking, could it be a dairy allergy or some other food? But dairy would be high on my list. And the other things I'm thinking about, could this be mold? And could she have high histamines? Histamines Histamine cells are throughout the body, and they're actually one of the causes also for insomnia. So if someone's eating leftover food from the night before or from the day before, that itself can trigger histamine release, because the histamines develop in that food. Or if someone has dried fruit before they go to bed, there's a long list of foods on the internet. So you can put them on a low histamine diet for 3 weeks, and then tell them to have a lot of histamines for 2 or 3 days and see how they feel. Does their nose feel blocked up? Does their skin get itchy? Their bowels not work so well? Do they have trouble sleeping? Does their brain not work so well? So that'll give you an idea if they're sensitive to histamines. This girl, when she was young, had several episodes of pneumonia. Now, even one episode of pneumonia tells me this person has got a very low immune system. No one should be getting pneumonia, particularly in their 12 or 13 or 14. So again, I'm looking at her immune system. Again, I'm looking particularly at vitamin C and zinc, and I'm looking at protein. And like I've added to the case history these days, I think a lot about toxicity. If someone's getting a lot of infections, think of toxicity. Think of things like mercury, think of lead. You might think of plastics, affect thyroid function. Now she had many antibiotics for these various pneumonias, so she definitely would have developed SIBO. And when I did a test, she actually did have that. Now, interestingly, the reason she came to me because I had treated her brother. Now, for reasons that I don't understand yet, boys get much better and much quicker than girls with chronic fatigue. So I saw her brother, who was at that stage when I first saw him, he was about 17 or 18. And within a year, he got better. Whereas you'll see with the young girl, she took a little bit longer. But boys get better much quicker. And the guy that does a lot of testing for us in Melbourne, his name is Henry Butt from Bioscreen. He's finding that the gut bugs in men and women, there's a significant difference in the variety of bugs they get, the quantity of bugs they get. So there's quite a big difference. Okay, next slide. Now, all of this you would know. Next slide. Yeah. Now, she had very pale conjunctivitis. So I looked in her eyes. The eyes were quite pale. Now, if the palmar creases are getting pale, you know that her hemoglobin's very low, but this girl was not. She had no postural drop, but when you get a chance, I've written down that Bateman Horn Center. Go and have a look at that, because that's a really good way of explaining postural hypertension to your patients. So you got to lie them down, make sure they're relaxed, check their blood pressure with a normal sphygmomanometer. Don't use an automatic one, because the automatic ones are just not quite effective. They're not accurate. Now, when the patient stands up, make sure that the sphygmo is roughly in line with their heart. Okay? So lying down, blood pressure and pulse. And normally when you stand up, your blood pressure should go up slightly. These people, often the blood pressure actually falls, or even if it stays the same, it's abnormal. But if the pulse rate goes up by more than 25%, that's definitely full-blown POTS. And you would do that every minute for 2 or 3 minutes to see how long it takes them to recover. Most patients will recover after 3 or 4 minutes, but some of them don't, and those are really severe ones. Just to make this a bit interesting, so it's not too boring, I'm going to tell you quickly about my treatment for POTS and postural hypertension. So in a cooler country like Australia, the first thing I get them to do is to wear stockings. The stockings have to go above the knees. So all that's doing is compressing the veins and getting blood flow back into the circulation. The second thing, you get them to drink more water, have a little bit more salt, and then I use a lot of rehydrating solution. Now make sure that if you're giving them rehydrating solution, that it doesn't have sugar in it, because unfortunately, like things like hydrolyte has a lot of sugar in it. Now you can actually make up your own. You can put in a liter of water, you could put a teaspoon of salt, get some potassium chloride, throw in a little bit of magnesium and zinc, and you're going to have some rehydrating solution. So they can drink normal water plus your rehydrating solution. Now, if they want to buy it on the internet, the brand I use is called ProGert, P for Peter, P-R-O-G-U-R-T, Progurt chloride. Progurt chloride. And they put 5 mils of that in a liter of water, and they drink that by 4 or 5 o'clock, plus other water. If I've done the stockings and a rehydrating solution, their blood pressure is still not coming up, then I use Florin F, which is fludrocortisone. That's not a corticosteroid. This just makes you retain sodium, and so you retain water, and it pushes your blood pressure up. You might start with just 1 tablet in the morning. That's not working. And you can go by symptoms. You tell them if within a week, if your dizziness is not improved, take 1 in the morning and take 1 at lunchtime. Now, you just have to be a little careful with Florin F. If they're taking more than 2 a day, their potassium can drop. So you might need to give them some extra potassium. And the easiest way to give people potassium is get them to have a mixed, only vegetable juice. No fruit, only vegetables. Now this girl's feet and hands were very, very cold. And that was just her sympathetic nervous system being overactive. That's often due to low magnesium. Could be low EFA, could be low B vitamins, and of course it can be due to low thyroid. She had cracked heels. You can go through all of that. I made a little mention about the calves. Her calves are not tender, but the calves are tender. It suggests that an antioxidant level is low, particularly the fat-soluble vitamin E. So the calves are very tender. That's a reasonable clinical sign of low vitamin E. She had definite horizontal grooves, which we've demonstrated to you before, called Bowes lines, where the nail kind of grows, and then there's a little dip, and it keeps growing. And showing her digestion wasn't working very well. She had white spots. The posterior part of the tongue was yellow, and the tip of the tongue looked like a strawberry. Now, crimson crescents, interestingly, in that first chronic fatigue consensus document, that refers, the only thing I've ever seen that refers to crimson crescents in the Canadian consensus document. Okay, next slide. You must palpate very deeply. They tender over the right iliac fossa where the appendix is. That's the cecum full of bed bugs, okay? That's showing there's severe dysbiosis. Now, if you go onto YouTube, there's a very nice ileocecal valve release. So it's hard to demonstrate it here, but if you go onto YouTube, there's a nice demonstration of ileocecal valve release. Now, so some people that are getting a lot of bloating and discomfort, doing that valve release 3 or 4 times a day can really make a difference. Now, one of the tests I do on all my patients, a couple of tests. One is I always check their pupils to make sure they're facing the dark side of the room, or even pull the curtains, and then shine a bright light and see how long it takes, whether their pupils can immediately stay constricted, which is normal, or if they immediately dilate. And if you're getting them better, that time to dilation will slow down, and they can actually sometimes keep their pupils constricted for much longer. It's an objective measure of adrenal fatigue. And the other one I do is the Romberg's stance, where we get them to close their eyes, 1 foot in front of the other, hands in front of their thighs, and you'll find quite often they topple over. That's due to their brain sugar being low. Okay, brain sugar being low. Even though the blood sugar is normal, their brain sugar is low. Okay, next slide. This girl's diet was high in carbohydrates. Now, the reason I put that in there, when their diet's very high in carbohydrates, it means their insulin could be an issue, but they're not making stomach acid. So the moment someone's diet is primarily carbohydrate and very little protein, their stomach acid production is going to be impaired. Now, if their protein is low, they're going to have poor cognition, because you need protein for your brain to work well. Now, we're not talking about too much protein. We're always talking about optimal protein. So the formula we use is 0.9 milligrams per kilogram of body weight. So if someone's about, say, 60 kilograms, they need roughly just under 60 grams of protein. But if they're deficient, they need a little bit more. And all older people, so these days, anyone over about 60, quite often they're protein deficient. We call that sarcopenia. And they're getting weak, that's called dynapenia. So those people need to increase their protein by about 20 or 30%. Now at the bottom of the page, I've written down that brown basmati rice in particular is an excellent detoxifier. So most of my patients, I get them to have a little bit of brown basmati rice. Now, you know, with any carbohydrate, if you put it in the fridge or in the freezer even, which is better, and let it cool, and then you reheat it, you reduce the sugar by 50%. This girl was eating very little seafood, which most teenagers don't eat much seafood. So the inflammatory reactions are going to be higher. Okay, next one. Make sure you all use the multi-system questionnaire. So again, if you go into Google and type in multi-system questionnaire, there's a couple that you can use. So I get all my patients get in the habit of doing that as they come in. This is probably one of the most important slides in this presentation. So I've written down there, if the digestion score is high, what you're looking at, so you can read through that. If the emotional score is high, you remember the type 2 nutrients that we talked about when Professor Mills first started his course. So again, looking at protein, amino acids, zinc, magnesium, and quite often they've got a lot of cytokines. We don't have it in Australia, but they have it in America, where you can actually take a device, put it on your skin, not take blood. You just put this patch on your skin, and it can measure your cytokines. So hopefully we're going to get that very soon. That's a really good way of measuring cytokines, just on the skin. Head score, again, inflammation, joint score. So you can go through that and have a look at it. This is very, very important, this MSQ. So because the patient filling it in, it's an objective score of how they're going. And if you're doing the right thing, the numbers are going to get lower and they will progress and improve. This girl's score initially was 87, which is high, but you know, I get some people that are 150 and 200. So if I get someone who's over 150, it's going to take a long time to get them better. Now, but the fifth line from the bottom, I put in a reference for mast cell activation syndrome. There's a guy called Dr. Afrin, A-F-R-I-N, and he's done some superb work on mast cell activation. He's the one that's brought it to the fore. And he's a very orthodox hematologist. He's not at all alternative, but he has shown us what mast cell activation syndrome can do. Okay, next slide. So this was my list that I was working from at her first visit, that she had post-viral syndrome, that she had adrenal fatigue, severe low immunity. Remember all those pneumonias and the infections she was getting? With all the antibiotics, she definitely had SIBO and food allergies. The Bose lines confirmed she had maldigestion and her tummy was quite tender. I'll show you her Nutr-check, showed that she had a lot of nutritional deficiencies. Her EFA was low because the skin was quite dry. And I'm going to talk to you very briefly about pyrols. Next slide. I better get a move on because I'm a little bit behind. Now, in younger patients that are complaining of anxiety, they could easily be a pyrol. Okay, so they often have perfectionist tendencies. They can be very anxious. They can be obsessive. But the physical examination sign is that their second toe is longer than the first toe. This happens quite often. The people with their second toe, quite often they're perfectionists. Often these people are going to have zinc spots. Now the sign of low B6, because the pyrols are low in B6 and zinc, because that's what they secrete. They use it in their urine. They get B6 and zinc depleted. But if you look at their thumbnail, the lunule is that little curved area, particularly on the thumb. So if you look at your thumb, that little curved area next to the cuticle of your nail, that's highly suggested you're B6 deficient. And to confirm that, you ask them, do you remember your dreams every day? And we should all remember our dreams every day. And if they say no, then they are B6 deficient. Now, I used to do a lot of urine testing, but even with us, the test has to go to Queensland, which is in another state. It's going to be frozen, and it's quite a palaver, and it's very expensive. So these people actually do this questionnaire. So if you look at vanitadahia.com, she's got a very good questionnaire. You can do the questionnaire, put them on B6 and zinc for even 6 weeks, and do the questionnaire again. If it improves by more than 25%, it's a definite pyrol. And then you're going to adjust the B6 and zinc depending on their symptoms. Now, particularly if they've got any kind of stress or an infection, their pyrrole can actually get temporarily worse. So whatever dose of B6 and zinc they're on, warn them. If you get an infection, if you've got major exams, if someone dies in your family, double your dose for 4 or 5 days. And when the stress is eased off, you can cut back again. Now, pyrroles are associated particularly with autism, but also with heavy metals and neurological disease, but particularly with autism. Okay, next slide. Now you can read through this. I do these kind of tests on most of my patients, full blood count, biochemistry. On this girl, I did a glucose tolerance test. I think actually I didn't do one on this girl because she was really scared of needles. But Dr. Mel's question, I think, suggested she had hypoglycemia. But generally, I would do a glucose tolerance test. Serum copper, plasma, zinc. So you want them to be equal. So if the copper is higher than the zinc, these people are restless. They cannot sit still. They're agitated. They're moving. They can't concentrate. And inflammation will do that. And when you balance it up, they'll be much better. Okay, let's keep going. Next slide. Now, Navdeep and Sumi, I'm not going to put you on the spot and ask you how to read this, but you should know how to read this. So this is a typical hair analysis test. Forget the top panel. Don't look at the top panel. Just look at the bottom panel. Now, the first thing you're going to notice that most of the bars are to the left-hand side. So the first thing it's telling you this person doesn't digest very well. Okay, so most of the bars are to the left-hand side. So all the micronutrients are low. So that she's got a big digestive. This is actually not my patient. I'm just putting this in as an example. Digestion issue. Now, if you look particularly at the lithium, which is about in the middle of the page, when the lithium is so low that it's not recordable, that person's risk of dementia is very high. Okay, so unrecordable lithium, increased risk of dementia. So you can buy something called lithium orotate, lithium OROTATE. It's only 5 or 10 milligrams. You might just give them 2 a day for a couple of months, and then I give them about 3 a week. And that'll bring up their lithium. Now, I couldn't explain this easily, so I'm going to tell you, this is how to interpret mercury. So we're not looking at the top part of the picture, we're only looking at the bottom panel, what they call essential and other elements. The first criteria is that if 4 bars go into the pink zone, either side, 2.5 or the 97.5, if you've got 4 bars in the pink zone, that's mercury. Now, if you look, this girl has got 1, 2, 3, 4, 5, 6 bars in the pink zone. She's definitely mercury toxicity. Now, normally you should have 11 bars. You need to write this down. Normally you should have 11 bars in the green section. This person has got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So they've got 13 bars in the green section. But if they had if they didn't have 11 bars in the green section, if they had less than 11 bars, that's mercury. So the first criteria for mercury is 4 or more bars in the pink zone. The second one is less than 11 in the green zone. That's number 2 criteria. And the third criteria is normally you should have 5 bars going to the right and 5 bars, and more than 5 bars going to the right and 5 bars going to the left. Now in this girl, you can see going to the right, you've got zinc, manganese, molybdenum, boron. So she's got about at least 5 or 6 on the right, and most of them going to the left. But if she had less than 5 bars going to the right or less than 5 bars going to the left, that's also mercury. The 3 criteria: 4 in the pink zone, less than 11 in the green zone, and less than 5 bars going to the right, and less than 5 bars going to the left. So we haven't even looked at the top panel. Well, the top panel confirms it's mercury. But even if the top panel was normal, this would still be high mercury. Now, the other important thing that this test shows us is copper-zinc balance. And if you look, our copper is actually very low compared to her zinc. So our copper is 12, and the person's zinc is 190. So you can, by the bars, you can see that the Copper is much lower than the zinc. Okay, next slide. Oops, writing in front of me. Okay, now this person has, look at the bottom section. Again, all the bars are heading to the left-hand side, which suggests that their digestion is not very good. But if you look at their copper is very high compared to their zinc. So the copper is 81, but it should line up with the zinc. So as long as the copper and zinc are in balance, it's okay. But you can see a copper is going to the right, but her zinc is very low. So this person's got high copper compared to zinc. Again, their lithium is unrecordable. It's something I see a lot. Now, the top tip for this one is, see the cobalt? Cobalt is involved with B12 metabolism. So if the cobalt is so low, it suggests that their B12 might be an issue. I'm sure by now you're all getting a little bit confused. The criteria. So the first criteria was 4 bars in the pink zone, and you can see this person's only got 3. The second criteria was there should be 11 or more in the green zone. Now this person has got, counting from the top, 1, 2, 3, 4, 5, 6, 7, 8, 9, maybe 10. But no, they definitely don't have 11 in the green zone. So this is definitely mercury also. Okay? So I'm going to count from you from the top. Sodium's in the green, potassium's in the green, zinc's in the green, boron's in the green, iodine's in the green, phosphorus, sulfur, iron, germanium, and rubidium, and possibly zirconium. But this person definitely has mercury. And then the next one, the last criteria was we need 5 bars to the right, 5 bars to the left. And you can see this person has got only 3 bars to the right-hand side. So there's 2 criteria telling us that they've got mercury. And then when you look at the top, you can see the mercury looks a little elevated, but in fact, it's very high. Now, whenever copper is very high, first treat the copper. So you put them on high zinc foods and put them on high dose zinc. So for me, high dose zinc for someone like this is going to be like zinc picolinate or zinc citrate, probably 50 milligrams 2 or 3 times a day for a month, then cut it back to 2 a day. Look at the white spots on their nails. And then I would probably repeat this test after 3 or 4 months. And then I would start treating the mercury after that. So I would first treat the copper, and then I would treat mercury. Now this person on this hair analysis doesn't have it, but if the calcium and magnesium go to in one direction, and the sodium and potassium go in the opposite direction, that's adrenal fatigue. Okay, so if calcium and magnesium go in one direction, and sodium and potassium go in the other direction, it's adrenal fatigue. Okay, next slide. Now this is stuff that we've already done with Professor Mel. Her hemoglobin was good, but if the hemoglobin was low again, I would be looking for ferritin, check her ferritin, look for chronic kidney disease, look for any kind of chronic inflammatory chronic disease that's going to reduce your hemoglobin. High MCV, first, in Australia certainly, first think of alcohol, and then you think of lack of B12 and folate. Low white blood cells, commonest scores would be low protein. So even in our society, particularly when people are getting older and sicker, their protein consumption can drop a little bit. So if someone has consistently low white blood cells, so besides radiotherapy that can damage your bone marrow and chemotherapy, but you're looking at low white cells, inadequate vitamin C, not enough zinc, and again, toxicity. Ideal serum potassium is 4 to 4.5, but just remember that most of the potassium is intracellular. So the serum is not a good way of measuring potassium. You really need to do like a 24-hour urine potassium. Bicarb, We want your bicarb really around 26, 27, particularly if you've got cancer. And the best way to make them alkaline is by using either vegetable juice. Now, if their bicarb was sitting at 22 or 23, I would consider them to be a bit acidic. And generally, acidity would be caused either by a germ in the bowel. Sometimes it can be caused by eating too much meat and not enough vegetables. Urea, we've told you, reflects protein intake. Creatinine is muscle. Albumin. Now, this is a very important one. So you can do this when you do your normal blood test. So the albumin globulin ratio should normally be more than 1.8. If the ratio is not greater than 1.8, the person could well have subtle inflammation, some low-grade inflammation. Okay, so the normal albumin globulin ratio should be more than 1.8. Next slide, please. Ideal insulin according to Dale Bredesen. Okay, Bredesen. He's the guy, the Alzheimer's guy, Dr. Dale Bredesen. He's got a program to reverse Alzheimer's. He's saying an ideal insulin is less than 5. Ferritin, again, this girl was particularly low. Okay, it was very, very low, 21. So either she was not absorbing her iron, or there was a germ in her bowel that was using up iron. Those are the two causes, okay? Could be heavy period loss, maybe a vegetarian or a vegan, just not absorbing iron, but also think bowel. Sometimes SIBO, there's certain germs in the bowel that can cause your iron to be a bit low. Thyroid was on the low side. Copper was higher than the zinc, which kind of goes with the hair test. In fact, it wasn't her test though. This is a really good reference that you can show your patients. So if they go to Western Price Foundation, copper zinc imbalance, there's a really good article on copper zinc imbalance. So have a look at that. Just remember, if your homocysteine is above, say, 8 or 9, or if it's below 5, they're poorly detoxifying. They're not detoxifying very well. So an ideal homocysteine is somewhere around 7. You don't want it too high, but you certainly don't want it too low. Next slide. I won't go through all of this, just I'll point a couple of things out. If the urine volume is very high, either they're not eating enough omega-3s, or mercury toxicity is more common. So a very large urine volume, think of mercury toxicity. I don't know if you remember, when you worked in hospitals, you have learned about head trauma and the syndrome of inappropriate ADH. Syndrome of inappropriate ADH, where they're putting out massive amount of urine. And the way to fix that is to restrict their fluid. But in general practice, you don't see that too often. In general practice, it's going to be either mercury toxicity or not enough omega-3. Now, this girl's sodium was very, very low. Quite often in chronic fatigue, they have low aldosterone. Now, aldosterone is the one that makes you retain sodium, but her aldosterone was so low that she was losing sodium, and she had lost sodium for such a long time that her urine sodium was very, very low. And that could have been the cause of someone developing low blood pressure when they stand up. So the first thing to do would be to replace her sodium. Magnesium was a little bit low for me. I like it to be well above 5. The range from my lab is 3 to 7, so I want them about 5.5 to 6. The zinc was definitely low. So low zinc is going to affect immunity, stomach acid, protein production, a whole range of things. Next one, please. You're all experts on saliva, I would imagine. So I'm going to skip the saliva one, but her afternoon cortisol was very low. So I tell people, even before I do the test, whenever you're getting a flat patch, in days gone by, I used to use a lot of ashwagandha, withania, and I used to use adrenal cortex, but these days I just go for cortisone acetate or hydrocortisone, whichever you prefer. Now, Life Extension does a product called adrenal cortex, and this girl, you'll see in my history, she responded really, really well to the adrenal cortex. Now at night, if someone can't fall asleep, I was talking to you about doing melatonin and stuff as a rescue treatment. But once you start to investigate them, if you find that they're still having trouble falling asleep, you can either do a salivary cortisol, or you can just do a trial of phosphatidylserine. start off on say 200 or 300 milligrams, and you can go up to 600 milligrams. Now, the advantage of phosphorine, so it brings down the night cortisol so we can fall asleep, but it's also very good for our cells. So now that I'm in the older age group, I actually take phosphorine a few times a week because it's good for my cells. So all of us should take, besides omega-3s, we should take some phosphorine. Even if you just do it 2 or 3 times a week, it makes your cell membranes work much better. Okay, next slide. Now, parasites are a little bit controversial. From what I've learned, Dienamoeba is always pathological, whereas some people can live with blastocystis. So if they've got blastocystis and they don't have any symptoms, better not to treat. But if they've got blastocystis and they've got symptoms, then you got to treat it. Now, there are 3 things in treating any kind of parasite, but even in treating SIBO. Nothing works if you just give it orally. You have to physically empty out their bowel. So I give them a laxative once every 5 days or once every 7 days for 2 or 3 weeks at the start of the program. So only say 3 times. And they have to take something like Pico Prep. Some of them do a colonic. Some of them might have some other strong laxative that they prefer, but as long as it empties them out completely. So they take it at night, it empties them out the next morning, then they start my protocol. The second thing is they want to limit carbohydrates. And the third thing, they must alkalize between meals. So my protocol for the parasites is to use this antibiotic called paromomycin, which is a stronger version of flagyl or metronidazole, but you're only using it for 10 days. But the problem is no alcohol with that because it can make them feel sick. Then after that, you go on 10 days of trimethoprim. Now, whenever you're putting people on these strong antibiotics, they must go on Nilstat, and they must go on Saccharomyces boulardii. So if it's just a week of antibiotic, I don't think it's such a big deal. But if they're using prolonged antibiotics, very strong antibiotics, then you must use some nystatin, Nilstat, and you must use Saccharomyces boulardii. And we cleared this girl's parasite, and it did help her. Next slide. I'm probably not going to go through this because you don't really have access to it. I've been trying to get Dr. Mel to let us use this. He hasn't quite agreed yet, but I'm still working on it. But for me, once that, anything over 40% is very significant. You can see with this girl, most things were high: allergy, sugar, digestion, dysbiosis. Now, B3 is the one that makes stomach acid, and B5 is the stress vitamins. Okay, so whenever someone's very stressed, they use up their vitamin B5. But you can see her B3, B5, and B6 were being used up. Everything was low, just about everything was low. The only thing she passed was B1, and that's because she doesn't drink alcohol. So people that drink alcohol regularly, the B1, they deplete their B1 and that comes up high. But you can see the only thing that this girl really passed was B1. Everything was high. I use this a lot, but I understand that it's a little bit hard for you guys to use it. Next slide. So we rearranged our problem list a little bit, concentrated on the chronic fatigue, the adrenal fatigue. So gave her lots of B5, and then I actually put on the life extension adrenal cortex, which made a big difference. I did a food allergy test on her. But for you guys, I think the main thing really is dairy-free, gluten-free, egg-free. After 3 weeks, whichever one they miss, if they miss dairy and eggs a lot, let them start having eggs or dairy, one of them, once a week for 2 or 3 weeks. If there's no reaction, let them start having it twice a week and limit it to twice a week. So you're going to do dairy first or eggs first, and you're going to do gluten the last. And when they stay off gluten, they've got to stay off rye, oats, barley, and spelt. And sometimes even corn, because some of them react to corn. But the gluten they need to be off for at least 6 weeks. And then again, when you reintroduce them, pick one of them. So if they say, I like oats, let them have oats once a week for 3 weeks. If there's no gut reaction, brain reaction. So either going to get bloating, discomfort, or burping, or get a bit constipated. And an older person, they might say, my joints ache. And in younger and older people, they'll say, my brain's not so sharp if they're sensitive to gluten. It's going to be either a gut reaction or a brain reaction. SIBO testing, made sure she was eating protein. Now, because she was so young, I didn't actually give her betaine. I gave her just apple cider vinegar after meals. So I told her to have a teaspoon after the small meals and a tablespoon with the big meals. Now, if someone's not making enough bile, these are the things that increase bile production, particularly glycine. Glycine and taurine help you make bile. If they're having trouble digesting fat, first give them glycine, and often that'll be enough. And glycine is very cheap. It tastes sweet, but it's not a sugar. They can get glycine on the internet or from whoever sells glycine. Okay, next slide. This girl actually had high candida, which is for me quite unusual. I don't see that often. I only see that if they've been on a lot of antibiotics, which this girl had. Again, I give them a laxative. I get them to reduce the carbs, and I make them alkalize. This girl used, I gave her quite a few months, a month of Nilstat, nystatin, and I like Thorne's formula SF722. I did a month of nystatin, a month of Thorne SF722. And to be honest, after a while, I even end up giving her some itraconazole, and that worked quite well for her. I think we're going to skip the rest of this. If they've got a lot of brain fog, try and get a D-lactic acid-free probiotic. So when we make lactic acid, there's D-lactic acid and L-lactic acid. Our bodies can break down L-lactic acid, bodies cannot break down D-lactic acid. So the probiotics that have D-lactic acid, which you should not be using, are Lactobacillus acidophilus, Lactobacillus acidophilus, and Lactobacillus plantarum. Okay, so both of them produce a lot of D-lactic acid and give brain fog. Okay, next one. Okay, so this is what I did with this girl. I healed her gut. And these days, I use a lot of GIN caps. I use the Crystal Star. I use a lot of zinc carnosine. At the moment, I've got a guy who's had about 4 major operations for cancer in his gallbladder. And he was in hospital because he was pooing through his stoma about 6 liters of fluid a day. And they had him on like about T Imodiums and high doses of codeine. Nothing was helping him. And eventually they just said no. I put him on zinc carnosine, the Thorne GIN caps. I made him take 2-4 times a day. And in about 6 weeks, he's the best he's ever felt. His diarrhea is settled. He's off all his Imodium, all the for diarrhea, and he's fantastic. But they really help heal leaky gut. GIN caps, zinc carnosine. Now, interestingly, melatonin and nystatin help leaky gut. If you've got a very heavyweight person, fasting can help because you're just not eating anything or eating less. That will help. Of course, you can't do that if their protein levels are very low. Some of my patients are a little bit wacko. They believe in a thing called medical medium, and they use celery juice, and it does work for some of them. Now, when I'm starting on someone who's very well, I always get them to have very slow cooked food. So they have slow cooked protein, always very slow cooked, small amount, not just regular amounts, not too high to start with. I even get them to have cooked their vegetables and cook their fruit. So they even have cooked fruit, steamed fruit, just for the first month or 2. This girl did infrared sauna. She didn't do the coffee enemas, and I gave her a little bit of NAC. Put her on a lot of antioxidants, put her on some fish oil, and then we treated all the things at the bottom. You can see the specific treatments I gave her. Next one is adrenal fatigue, which you are, I'm sure, very good. Next slide, please, Sati. Yep. So adrenal fatigue, I use a lot of liposomal vitamin C. This girl responded very well to adrenal cortex, but these days I just goes for cortisone. I use a lot of cortex number 3. I use anywhere between 2 and 6 tablets a day. Now, if you're not sure if they've got adrenal fatigue, this guy, McJeffries, suggests that putting them on 2 tablets 4 times a day just as a therapeutic trial for a week or 2. And if they get better, it confirms. Okay, next one. Now, I won't go through all of that, but this girl improved quite well. She had a general anesthetic for some wisdom teeth, and then she really went backwards. And we had to give her another iron infusion and some more extra melatonin. Now, these days, on patients with inflammation, I use a lot of low-dose naltrexone. Start off at, sometimes if they're very sensitive, I might even start them on 0.5 milligram. The maximum I've used is up to 10 milligrams, but I know some of my colleagues have used up to 20 milligrams. But I find anywhere between 1.5 to 4.5 milligrams is very good for inflammation. It's very good for MS. It's very good for cancer. So if someone's got like an inflammatory bowel breast cancer, low-dose naltrexone can be amazing. At one stage, she used a bit of intravenous vitamin C. Now, about 2 or 3 years ago, I actually went to America and I did a mold course. So we're going to talk about mold very briefly. Next slide. So this guy Shoemaker was the pioneer, but unfortunately, his theories have now been superseded by ISEAI, which is some kind of international environmental group in America. I think it's environmental acquired infections. And Neil Nathan used to lead the group, and he's probably the leader on mold testing, and he's got a very good book out called Toxic. Now, it seems like if you've got the celiac gene, 20%, most of those people, 20% of, sorry, not most, 20% of those people with the celiac gene are quite sensitive to mold, and they get a lot of symptoms from it. Now, there's a couple of tests that I'm going to show you in subsequent slides, but a very simple treatment is to put everybody on activated charcoal. When you're first starting, if they're very sensitive, you only start it once a week. So it's an activated charcoal tablet, quarter tablet, once a week for a month. As long as there's no Herxheimer reaction, as long as they're not getting worse, you go to half a tablet once a week for a month. No reaction, then you go to a full tablet once a week for a month. After 3 months, you can start adding things like NAC, infrared sauna, and then you can slowly increase your activated charcoal to maybe twice a week or even 3 times a week. I've never used it myself more than twice a week on my patients. It's all very well to detoxify them from mold, but you've got to find out where the mold is coming from. So you've got to check their house, their work environment, their car. Do they spend a lot of time with their in-laws or with their parents who've got a moldy house? And the main thing is not just treating them, but fixing the plate, fixing the plate. Okay. The line at the bottom there is no point treating them unless the source of the mold has been looked at. Now, next slide. This is a very interesting slide. So this is called a cluster analysis. If 4 of those, you need to write this down. If four or less if they're less than 4, 85% chance they don't have mold. If it's more than 8, there's an 85% chance they do have mold. And the question you ask them is that most of the time, most days of the week, do you have any of these symptoms? So you go box by box. So each box counts as 1. So fatigue is 1. The next box under that is 2. And then you just go through that. So if they've got more than 8, there's an 85% chance they have got mold sensitivity. The common symptoms they complain to you, besides brain fog, is going to be tingling in their skin, numbness, paresthesia, and tingling. But each of those boxes is 1 point. So if it's more than 8, 85% chance. If it's less than 4, 85% chance they don't have it. Now, they just nod if that makes sense. Okay? Now, the next thing they do is they go onto the Shoemaker site, and there's something called a visual contrast sensitivity test, VCS. Now, if they can't afford it, they don't have to do it, but my patients do it. It costs them about, I think, $15 or $20. And if they fail the test, it helps me, because if they fail the test, and my treatment is going to make them pass the test eventually. And you'll find with that test, if they fail, they'll gradually get better. They'll eventually pass the test. But if they pass the test, then it's no point doing it again because it's not going to help us. So I do the cluster analysis, I do the visual test. Now the people that can afford it, you can actually measure the toxins in their urine test. So you give them NAC for 4 or 5 days, or put them in a sauna also, collect the urine after 4 or 5 days, you can actually measure them, and then you can give them specific things for specific toxins. But if you just use activated charcoal, it works for everything. Okay, next slide. We're coming to the end. Next slide's out here. So this girl's MSQ, you can see, started at 87. And the last time I saw her, which was a couple of months ago, she got down to 14. But I think she's developing a bit of insulin resistance because her mother's insulin resistance with cancer. And this girl has put a little bit of weight on. But you can see her MSQ has dropped. So it's taken me 3 or 4 years to get her really well. So by the time she got to about early bit of 2020, she was much better. So by the end of 2019, she was back at school, and she did her final school exams over 2 years. So she's done really well. Okay, next slide. Okay, so these are my messages for you. The main thing is to individualize. There isn't a kind of answer for everybody. You've got to look at individualizing the treatment. Always take a good history. These days, I always like my patients to come in with someone, because quite often the husband will come in and he doesn't say that he drinks. And when the wife comes in, she suddenly tells you, oh, he drinks 6 beers a night, which he didn't admit to. He told me he only had 2 or 3. So, you know, I like people to come in with a friend or with a relative. I actually record my consultations because they're so long and complicated. Chronic fatigue people are just not going to remember things. So I get them to record things. Examine them. And if you're doing the right thing, the examination will get better. Now, if you're unsure of my explanation of the hair test, have a look at Andrew Cutler's book. He's got a very good at interpreting hair tests. And the lab that does the test of the bell curve is Doctor's Data. You've got to get the bell curve to interpret it properly. Look at the problem list, and each time they come in, you're looking at that problem list and you're changing it. Please start with digestion, diet, and detox. Always start with digestion. Then look at diets. If their digestion's right, there's no point fixing up their diet. So get the digestion right, heal their leaky gut, then worry about diet, then worry about detox. I think stool testing is very important. So please talk to either Selvin or Dr. Baljeet about which tests they use. I'm not sure which labs you use for stool testing, but I think that's probably it's more important than the food allergy test. These days, I don't do food allergy tests on everybody, but I certainly do food testing on all chronic fatigue patients. I always test them for parasites, because quite often if you treat them for parasites, they get better. You don't have to worry about the rest of the stuff. And always fix up their protein, their zinc, and the magnesium. Okay, that's it. Now, please ask some questions. Last slide. I'm not going to know if you've understood what I'm saying if you don't ask me a few searching questions, please. Anyone? Don't be shy.
Feel free to unmute yourselves and can ask your questions.
I'm happy to go over the hair analysis thing because I know it is complicated.
Yeah, Dr. Ashley, could you please go through the chart again?
Yeah, sure. Sadi, can we go back to the head, the one with the graphs, the colored graphs?
Oh, okay. I'll see if I can. This one?
No,
yeah.
it's a graph.
Yeah, the previous one.
It's about 2 or 3 in front of that. Keep going, back. Keep going.
Yeah.
Keep going.
There's another one.
The one before this, one before. Just say this 1 second. Okay. No.
Not this one?
No, come back to the next one. That's it.
Yeah.
Okay, so there's 3 main criteria. If you have 4 bars, looking at the bottom of the slide. Don't look at the top half of the slide at all. Only look at the bottom half of the slide. So if you look at the top half of the slide, that's hair testing, hair interpretation for dummies. Okay? So you can just look at the top half and ignore the bottom, but that's very basic. You're going to miss a lot of things. So we look at the bottom half, which says essential and other elements. If you have 4 bars in the pink zone, that is mercury. Okay, so that's one criteria. You only need one criteria to diagnose mercury. So that's got 4 bars in the pink zone, it's definitely mercury. If you have less than 11 bars in the green zone, that's also mercury, because mercury affects absorption of minerals. So if you have fewer than 11 bars in the green zone, that's also mercury. Now this person has got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 bars in the green zone. So the second criteria is saying it's not mercury. She's already got mercury from the first one, so we don't have to move on. But the second criteria is less than 11 in the green zone. And the third criteria, normally you would have 5 or more going to the right, 5 or more going to the left. So if you have less than 5 going to the right, or less than 5 bars going to the left, that's mercury. And this person has 1, 2, 3, 4 definitely going to the right. She doesn't have 5. So she's got 2 criteria for mercury, the 4 in the pink, and only 4 bars are going to the right. Navdeep, can you see the ones I mean? So zinc is going to the right, molybdenum going to the right, boron, and selenium. Only 4. We need to have more than 5.
Okay.
So any of those means it's mercury. Okay?
Yep. Okay, got
it. Second important thing on this slide, because all the bars are to the left-hand side and the bottom half of the slide is telling you this person's not absorbing very well. The second thing is you look up copper zinc ratio. Her copper zinc ratio is very good because the copper is low to the left-hand side and the zinc's a little bit to the right-hand side. So the copper zinc ratio is good. The lithium is absent, which worries me a lot. And this particular person was losing a lot of potassium or not eating vegetables at all. Okay, the potassium was very, very low. So if you're eating any vegetables, it's not just, and even fruit, if you're eating enough fruit and vegetables, your potassium is going to be a good level. It's not as accurate as measuring it in the urine, but it's still a good guide. Sadi, can we please go to the next slide? Now, if we look at this one, again, looking at the bottom half of the slide, she's got 3 in the pink zone, so it doesn't quite meet the criteria because we need 4 for mercury. But if you look at the bars to the right-hand side, there's only 1, 2, 3 bars going to the right-hand side. So it definitely is mercury. And then if we count in the bars in the green zone, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, perhaps 10 in the green zone. So it hasn't got, you need to have more than 11 in the green zone to be normal. So if you got less than 11 in the green zone, that's mercury. So there's 2 criteria here for mercury. So it's definitely mercury. All you need is one criteria. One criterion is enough to diagnose mercury. And again, this person has got no lithium. It's completely absent. So lithium is 0.007. And this person is so low, the lab can't measure it. So their risk of dementia is very high when they get older. So you must replace that lithium. And this person, the copper is very high compared to the zinc. Normally the 2 bars should be exactly the same, but the copper is incredibly higher than the zinc. So you can tell the parent, look, this child, or if it's an adult, if it's a child, they're going to be anxious. If it's an adult, they're not going to be sleeping. They're going to be restless. They might have ADD. They're going to have a lot of issues. And the other one with this person is that cobalt was very low. It was below the range. And cobalt's very important for B12 metabolism. So the cobalt is so low, they've got an issue with B12. Okay, the question came up in the chat line. How high a dose of vitamin D for fibromyalgia? It depends on the blood test, really, and the age of the patient. So for most people, If the vitamin D is very, very low, I do not replace it initially. I actually treat them, get their fibromyalgia a little bit better by looking at the food allergies, helping their sleep, looking at their bowel, giving them low dose naltrexone, giving them fish oil. And these days, instead of fish oil, you can get something called S for Sam, P for Peter, M for Michael. Do you know about SPM? Specialized pro-resolving mediators. Yeah. S for Sam, P for Peter, M for Michael. Specialized pro-resolving mediators. So these are kind of endpoints beyond fish oil, beyond the EPA DHA that's very anti-inflammatory. So if someone's got fibromyalgia, I don't give them vitamin D until I've treated them for a bit. Now, if it's someone here who's very pale, I might give them 1,000 or 2,000 a day. Someone like me who's a little bit darker, I use about 5,000 a day. And someone particularly who's older, so vitamin D has to go from your skin to your liver to your kidney to be activated. And that process doesn't work well as we get older. So in older people, I'm tended to give them more vitamin D, at least 5,000. These days, we use a vitamin D injection. So we give them 600,000, and that lasts them usually for a year. But just remember, if you give them an injection and they've got inflammation, you can make it worse. So that's why if you give them the tablet at first, it's probably a better idea. But if they get worse, you can stop it and they'll feel better. For patients, GFR lower than 60, what can we give to raise the GFR? I think we did a lecture on chronic kidney disease. The main thing is investigating their kidneys for heavy metal toxicity. Now, the more I investigate people with kidney disease, a lot of them have got heavy metals. A lot of them have got mercury and lead and arsenic and cadmium. Remember, arsenic is concentrated in rice, particularly in white rice. So that's a source of arsenic. Arsenic can come from chickens. Lead can come from batteries. Mercury can come from seafood. So do a hair test to check their kidney, to check their heavy metal level. They need a lot of antioxidants, particularly an all-around antioxidants. So if you have a look on the internet, I use a company called Biomedica, and they do something called OxyGuard. But you'll find your own multi antioxidant. So it needs to have a bit of vitamin E specifically. And remember, there are 8 different types of vitamin E. So we need 4 tocopherols and 4 tocotrienols. And it looks like that the tocotrienols are much stronger. So for this, to raise the GFR, I'll put antioxidants. I'm going to give them high-dose vitamin E. From the lecture, you will remember that B5, the activated form of B6, B5P, is very good for kidney function. I would treat their homocysteine. I would check their blood pressure. I'd see if they're losing protein from their kidneys. There are a lot of things that we would do. But basically, antioxidants, checking them for heavy metals, high-dose vitamin E, sometimes selenium to detox them, certainly P5P. Yeah. If hair analysis is not available, is it good enough to do serum copper and plasma zinc? Yes, it is. But realize that test is not perfect. Always go with symptoms. So have a look at their fingernails, looking for zinc levels. Can I elaborate about an egg-free diet? So if I put someone on an egg-free diet, there's no eggs at all for 3 weeks. Okay, so no eggs in the bread, no eggs in anything. Then after 3 weeks, I let them have 2 or 3 eggs once a week for 3 weeks. And I'm looking to make sure they're not getting any brain symptoms like brain fog. They're not getting any gut symptoms like bloating or burping or any kind of noises in their tummy, like their tummy making noises bothering me. Or if they're getting any joint symptoms. So as long as that doesn't happen, then from once a week, I let them have it twice a week. And I don't have it more than twice a week because eggs are, for me, when I test my patients, when I do blood testing, eggs are the ones that come up the most. So I find some people so don't give eggs to people every day. Limit it to 2 or 3 times a week. Now for of K2 with vitamin D above. Have a life extension. Again, they have a one called MK2 and it's got the MK2 in the D3 already. And from memory, it's about 400 micrograms or 600 micrograms of K2. Nordic Natural, the strongest Nordic Natural product is Ultimate Omega. Remember, it's fish oil. Fish oil goes rancid very easily. So whenever you open the bottle of fish oil, keep it in the fridge, because fish oil is like butter. It goes rancid if you leave it out of the fridge. So once you open the bottle, keep it in the fridge. And if I was using something like Ultimate Omega, I really want people to have somewhere between 3 and 6 grams of EPA and DHA a day. So I'm wanting quite a big dose for an anti-inflammatory effect. Sometimes for depression, I might go up to 8 or 9 grams a day. That's quite a lot of tablets. Just remember, when you're using the very high dose, they can get nosebleeds, so you might have to back off a little bit. And if they get nosebleeds, give them a bit of extra vitamin K. So I use the Nordic Natural Ultimate Omega. Any more? Is gluten-free dairy? No, remember, no allergies are forever. I think gluten is the only. Now, please go to PubMed. And the researcher's name is Fasano. Where do I type in? Fasano Zonulin. So Fasano is a guy, Italian guy in America who does all the research. And he has shown that anyone who eats gluten gets a leaky gut for up to 2 or 3 days after the gluten consumption. So gluten is probably the only one in a sick patient that I might keep them off for a prolonged time. But even egg allergy and dairy allergy can be overcome. So you take them off it for, say, 2 or 3 months. You heal their leaky gut. And again, I've talked to you about zinc, carnosine, aloe vera, licorice, slippery elm, all those kind of things. Melatonin, nystatin, all of those things heal leaky guts. After 3 months of treating them, then I reintroduce either the eggs or the dairy to see which one they can tolerate. And most people will be able to tolerate eggs or dairy at some stage anyway. So food allergies are not forever, but sometimes gluten is forever. So if someone's got autoimmune disease, they really should be off gluten. If they've got Hashimoto's disease or kind of rheumatoid arthritis, SLE, they should be gluten. For a 50-year-old man with chronic insomnia, 20 milligrams. Now, melatonin has a sweet spot. So if this man is, say, roughly 70 years old, don't use more than 7 milligrams. So with melatonin, start off low. Start off with 1 milligram. So I actually get them to get life extension 3 milligram lozenge, because the lozenge can be broken into quarters very easily and they can adjust the dose. When you put it under your tongue, it works within 5 minutes. But someone who's 50 needs roughly 5 milligrams. So start off with 1 milligram. They're not sleeping, within 5 days, double it and keep increasing it till you get that. So I did an experiment on myself. And once I went past, this was when I was about 60. Once I went past 7 milligrams, it actually kept me awake. Now, not everyone is sensitive like that, but a lot of people, if you have too much melatonin, it can keep them awake. So 20 milligrams of melatonin most likely is keeping this person awake. So if he's got chronic insomnia, the first thing to do is to check him to see whether he's a pyrrole, get him to do that questionnaire, put him on high dose of B6 and zinc. So high dose of B6 for me I start off with about 50 milligrams twice a day, and I'd go up to about 100 milligrams twice a day. And if that's not working, then I would try P5P, the active form, pyridoxal 5-phosphate. Yeah, P5P. And for zinc, if I'm using zinc picolinate, I might start off on 25 milligrams, but if they're not sleeping, I'll go up to 50 milligrams twice a day, even 50 milligrams 3 times a day for a month or so. So there isn't a right dose. The dose you want is the dose that achieves the effect. So with someone with chronic insomnia, I would treat him for pyrrole. If that didn't work, I'd give him lower dose melatonin. I would check him for obstructive sleep apnea. I'd make sure his sleep hygiene is okay. And then there's a whole range of herbs you can use. So, there's good herbalists, they can make up things like passion flower, ziziphus, you make them to do an alcohol solution. Always going to put it in very hot water the hot water boils alcohol and makes it more palatable to drink. And if chronic insomnia, I might give them a small dose in the morning, a good dose at about 5, 6 o'clock, a big dose just before they go to bed of the herbs, sleeping herbs. Now, I might even give them something like amitriptyline, but not more than 5 or 10 milligrams. So amitriptyline is quite good for raising serotonin, but if you have too much of a dose, it's going to make you get a dry mouth, and then it's going to block up the urinary tract. So, use small doses. Start off on, say, half of 5 milligram and maybe go to 10 milligrams. And then if I'm really, really stuck, I actually send them to a hypnotherapist. Now, I'm not sure what kind of mind-body medicine you have available in Kuala Lumpur, but there's a guy called D. Martini, Dr. D. Martini. I think his name is John. The D is D-I, and Martini, M-A-R-T-I-N-I. And he does pretty good courses on mind-body health, particularly for cancer patients, but for anyone with a chronic disease. And it's worth having a look at that. There's also something called the Richards Protocol, which is particularly for post-traumatic stress disorder, anything like that. So with counseling, you kind of relive everything, but this Richards Protocol, it's like a hypnotherapy technique where they kind of put you under and they wipe the memory out of your brain completely. So that gets rid of it. Okay, I heard the voice is not heard clearly. Can you tell me what you want me to repeat? Can you, Sumi, can you hear me?
You're breaking up.
Yes.
Breaking up in between.
Oh, really?
Yeah. It's lagging. Your internet is lagging.
Oops, sorry. I hope you heard most of it. When was it starting to break up? Was it recently or at the start?
No, in between your talks. There was, in between as well.
I think it's been quite some time. Yeah.
Well, someone should have told me earlier. I'm not sure why. So if you got any more questions, ask me some more questions. I particularly want you to know a little bit about mold. So if you suspect someone might have mold, you can do that cluster analysis. So you ask them, do you ever walk into a room and get a moldy smell? Now, if they say they get a moldy smell, that's very significant. So anywhere where you live or where you work or in your car, do you ever get a moldy smell? If they say yes, that alerts you that they might have mold. And then you can go through that cluster analysis. And if they've got, certainly if they've got 6 or 7 or 8, that's fairly significant. If they've got more than 8, it's mold. But even if they've got sort of 6 or 7, that's very significant. If they've got less than 4, it's unlikely to be mold. You can do the VCS test, the visual contrast sensitivity test, because mold affects how the back of the eye sees contrast. Or you can just put them on activated charcoal once a week, small dose. If they don't have a reaction, after a month, double it. After a month, double it. And then after 3 months, you can start adding infrared sauna or NAC and increasing the activated charcoal to maybe twice a week. Yes, Sumi? Hang on, there's a question here. 70-year-old advanced prostate cancer hormonal injections, testosterone, PSA injections. I think if you know this person very well, you can put them on testosterone, but you're taking a risk. So all the orthodox doctors feel that testosterone makes cancer grow. And I have to say, in my experience, if you block their testosterone, their PSA does come down. Whether that keeps them alive longer, I'm not sure. But really, we ought to be able to use testosterone with people on prostate cancer. So if I had prostate cancer, I would definitely use testosterone. But I'm not sure I would do it for a patient because you could get into trouble. You can get into big trouble with certainly in Australia if we use testosterone for people with prostate cancer. So I'd be really reluctant to do that. So the other things you can try, I'm not sure if you can get CBD oil, that can be quite useful for sleep. Melatonin is certainly good for cancer and for sleep, so you can try lower doses of melatonin. Benzodiazepine, very, very small. So why activated charcoal for mold intoxication? So, we have this hepatic recirculation of bile. So when we make bile in our gallbladder, it comes down into the small intestine, and then we reabsorb it, and we reuse that bile. And that's called the hepatic recirculation of bile. So when we use something like activated charcoal or cholestyramine, there's quite a few different binders. There's another one called Toxiprevent. There's a whole range of different binders, but activated charcoal is the cheapest one. You just have to make sure the activated charcoal has no heavy metals, because some are contaminated. So when you use that small dose, it binds the bile. The bile is pooed out, and your liver is forced to make fresh bile. And that very, very slowly reduces the amount of mold in the body. I've got a guy that with chronic fatigue I'd been treating, and he came back to me after I did the mold course, and it took him about 9 months to get better. But some people can take 2 years to get better. They will get better even before 2 years, but it'll be gradual. But after 2 years, you're going to get very significant changes. Some people after 9 months, significant changes. I actually don't treat children, so I don't use a lot of lithium. But if someone was, say, give me an age group. For example, if someone was 15, I'd probably use half an adult dose if they had no lithium. And if the child was under 10, I would use a quarter of an adult dose, roughly. But I'd keep monitoring hair analysis to make sure that the lithium comes up. So lithium, there's a really good article by Dr. Jonathan Wright, W-R-I-G-H-T, and it says something like lithium, the forgotten mineral. And it talks about all the amazing things that lithium does, particularly for sleep, for calming, for ADD, for restlessness, for concentration, and for preventing dementia. But it's only the absence of, so if the lithium is zero, that's when the dementia risk is increased. We're not going to give people, if their lithium is in the green zone on the hair analysis, we're not giving them lithium. It's only when they're very, very low. I hope I answered the question. Any more questions?
There's
No
one
more
more.
written questions? No. Yep.
Yes, there is one more.
Is there any other testing that we can done besides hair analysis for lithium? So there's a company called Quicksilver. I actually don't use them because their testing is a little bit expensive. But they do a urine test for lithium and mercury. But really, the hair test is the only one that really shows you what's happening. Yeah, I don't think there's any other tests for lithium. So when doctors do blood tests for lithium, they're doing it for really big doses of lithium. But the doses we're using are like 1/100th of the doses that the psychiatrists use. We're using like 5 and 10 milligrams of lithium orotate. It's a much safer form of lithium, and it's a very small dose. For dementia, lithium, I would be giving them, so if their lithium was absent, I would give them 5 milligrams twice a day for about 2 or 3 months. And then I'd cut it back to about 3 or 4 times a week, once only 3 or 4 times a week. And then I would redo the test after about 6 months. I'm losing the question. 1 second, let's scroll up a bit. How many criteria do make us diagnose chronic fatigue? Try not to give people labels. So I try not to tell people you have got chronic fatigue syndrome. Because once you put a label on someone, my God, they have that label forever. So you can tell them you've got chronic fatigue, but don't use the syndrome word. But the moment someone has got post-exertional fatigue and insomnia, and they're just so severely fatigued that they can't do all the things they want to do, I'm treating them as chronic fatigue. Don't worry about the actual criteria too much. That's more for your use. If someone comes looking at you or someone comes investigating you, you can say, these are the criteria I use. But in practice, post-exertional fatigue, insomnia, neurocognitive things, if they're getting anxiety, depression, poor memory, inability to concentrate, whereas before they could. In your slides, I saw T3 and T4, yes? Yes, there was something on T3 and T4, and I do use hormones, but I tend to bring them in later in the picture. I don't bring them in early. I just remember when someone's very tired, you've got to treat their adrenals before you treat their thyroid. So fix up the adrenal first. Give them the ashwagandha, give them the vitamin C, give them the B vitamins, give them some adrenal cortex, or give them cortisone first. And when the adrenals are under control, then you can start adding in your thyroid. Because if you start adding in thyroid too quickly, you're going to make them worse. All good? Now, particularly for the girls in the audience, I want you to look at this book. This is an amazing book. It's called Cystitis Unmasked. This is life-changing. This guy he's an orthodox researcher in England. He's also got a lot of free YouTube videos, so you don't have to buy the book. His name is Malone Lee, M-A-L-O-N-E, Malone, L-E-E, Malone Lee, and lots of YouTube videos, free ones. And he says that we shouldn't be doing a midstream urine, we should be doing a first catch urine. We shouldn't be doing culture because it's a useless test. And we should be just looking for symptoms of urgency. And if they've got white cells, they need to be on long-term antibiotics until the white cells are gone. And then he puts them on Hiprex for a few months. So I've been treating quite a few women with chronic, because if you've got a chronic urinary infection, you end up developing a lot of pelvic pain. So these girls come in with pain when they have intercourse, or just pelvic pain all the time. They get sciatic pain. They get a lot of symptoms remote from the bladder, because the infection goes from the bladder into the bladder wall itself and causes a lot of issues. And so on. And we used to call it interstitial cystitis, but it's not. It's actually chronic infection in the bladder wall itself. And long-term antibiotics, along with Hiprex, will generally fix them. But it's quite new information. I've been using it probably only for the last 6 months. And slowly the word's getting out, but it's very early. Not many people know about it. Oh, hang on, 2 new messages, sorry. The only way you can monitor the lithium level if they're on lithium treatment is just do a hair test. I usually do it every 6 months, and once it's stable, you might do a hair test every 5 years. The best method for mercury detox, there isn't the best method. You do all the detoxing things like drinking water, pooling regularly, NaC, maybe glutathione, but I use DMSA with ALA. So DMSA, I'll type it in. You need to get that from a compounding pharmacy. And the ALA has to be RALA. And you might start doing 100 milligrams of each. Things are working tonight. TDS, which is 3 times a day, just 2 days a week. That's what I usually start off though. So maybe giving them a dose of DMSA and lipoic acid, and then gradually increasing the dose. And I do that for 3 or 4 months. Give them a break for a month, do another hair test, make sure they're getting better. The main thing with mercury is to find out where it's coming from and stop the source. So if someone's at very high mercury, I sometimes do a blood test, take them all seafood for 3 weeks and do the blood test again. And sometimes their mercury comes right down in the blood test. So that's telling you that at least some of that mercury is from their seafood. So they need to not eat seafood. In Australia, most of the mercury is from fillings. So we really have to take out their fillings holistically and then detox them quite significantly. So I might start on that 2 days a week. And if they're doing quite well, then the next, after 3 or 4 months, I might double the dose to 200 milligrams of each and gradually increase the dose. And maybe from detoxing 2 days a week, I might do it Monday, Wednesday, Friday. I would never detox more than 3 or 4 days a week. The detoxification of heavy metals must be slow. And remember, if you've got heavy metals in your body, it amplifies the bad effects of EMF. You know, we're always talking about EMF, but if you've already got heavy metals, EMF effects are worse if you're already mercury toxic or lead toxic.
Dr. Ashley, when you reply,
Yes.
you have to change your son to everyone because the message will come to me only when you type.
Oh, really?
Yeah.
Has it gone to everyone now? Yes, there are studies. So that Nicole Bilsma is doing a PhD in EMF, and she's got a book out, and she's got a new book coming out. And at the moment, 8 other people and myself have written a book called The Fundamentals of Nutritional and Environmental Medicine that we hope will be out, was meant to be out now, but it's not going to be out probably till the end of the year, early next year. But there's a lot of stuff there on EMF and the effects it has. Yeah. So Nicole has a lot of references on her website, and even in the book she's got out at the moment, she's got a lot of references on the effects of heavy metals and EMF. Just go to PubMed. If you go to PubMed, you'll find quite a lot of stuff there. Okay. If there's no more questions, I think we're going to finish. What is the common symptoms of EMF amplifier? It'll be things like brain fog, insomnia, anxiety. So things that you would normally be able to treat with your normal things. If they're not responding, then you start thinking of EMF and heavy metals. But it's particularly going to be things like brain fog and anxiety, neurocognitive, brain not working so well. And they'll tell you that when they come into so they're in a certain room and they're not so good, but when they're away from that EMF source, their brain's working much better. Or when they go and sleep, if there's a lot of EMF in their bedroom, if there's a particular wiring behind the head of the bed or something that's causing the problem, then their brain doesn't work so well. They actually get brain fog, their words don't come out, they can't concentrate, they can't write, they can't read. Yeah. Okay. All done?
Yeah, I guess
Yeah.
there's no more questions. If there's no more questions,
Sure.
we'll end the session.
Okay. Thanks, everybody. Thanks for attending.
Thanks, Dr. Ashley.
Thank
Thanks,
you.
everyone,
No
for
worries.
coming.
And if you've got any questions,
Thanks, Sati.
You're welcome. Thanks
Pleasure.
for joining in. All
Thank
right.